Jai, over to you.
And when GQ dances the night away, my friends, he dances the night away. It's gone. Well, Dr. Brady is on assignment in Chicago this week, so we welcome in another healthcare professional. He's got your back, Dr. Shiraki. I love that commercial, first off. Reed Shiraki, chiropractor, joins us this morning. That is one of the great commercials, I think, of all time.
Oh, thank you.
What do we have here? Let me ask you first off, why should someone come see a chiropractor?
There's a lot of different reasons. First of all, the most common reason is they have pain, you know, neck pain, back pain, and that's the most common reason how a person would come in and how we can help them. But because the chiropractic can help align the spine and get the nervous system working better, just for overall wellness and better health, chiropractic can help tremendously.
Now, we're actually watching you at work right now, and this is what you would call an adjustment, correct?
Yes.
What goes into it? Does it depend on the specific problem you're having? If I came to you with a lower back problem, does that mean you would only work on the lower back, or is it a total spine thing?
Because the spine works as a whole unit, a problem in the neck could actually be affecting the alignment in your lower back or vice versa. So when we address the spine, we would want to go from head all the way down to the tailbone, and maybe even sometimes the feet. We would have to look at how a person's walking and standing as well.
Now, we actually have props with us.
Yeah.
If I could, showing the spine here, just to let folks know this isn't a real spine, or at least that's what Dr. Shiraki has told me.
It's a
what is the most common problem you have?
It really kind of depends on the kind of activities a person does.
I had the spine backwards, didn't I?
Oh, yes.
Okay, there we go.
Right. But if you're looking at the spine from the side, for example, because so many people are in front of the computers and things, the neck should have a nice curve this way. And when you're in front of the computer for a long time, one of the common things we see is a lack of curve in the neck. And this can put a tremendous strain on the joints of the spine here. The nerves can get pinched or interfered with, and the muscles can get tightened, and you get those neck pains or even maybe tension headaches from that position. Another common misalignment is what's referred to as a scoliosis oftentimes, where the spine can laterally bend. Okay. And this can also put pressure on the nerve, make the muscles imbalance, and cause pain in the lower back, mid-back as well. A lot of different problems can occur from a misaligned spine.
And I think that's the thing when people see the spine isn't straight. I mean, you kind of think of it that way possibly, but it's actually kind of has a curve to it, a couple of different curves.
Right. When you look at it from the front or the back, the alignment should be actually straight.
Okay.
Yeah. But from the side, the curves of the spine help to support the weight of the body. So when you look at the spine from the side, you should see a nice curve in the neck, and then an opposite mid-back curve, and then another opposite curve in the lower back. So 3 curves looking at the spine from the side, and these curves should be in place without a loss, or sometimes you get too much curve, which can also be a problem.
Oh, okay. Well, Doc, you can stick around and answer a few more questions for us if that's all right in the next hour?
Yeah.
Dr. Shiraki, Reed Shiraki, chiropractor. We will talk to him again in the 7 o'clock hour. We've got a few more questions we want to ask, and we also want to ask you about the honor box, because it's one of the great things that anyone does here locally, and so we want to talk to you about that.
Thank you.
Thank you, Dr. Shiraki. Hawaii's Morning News will continue. We'll have top headlines when we come back. Thanks for starting your Thursday morning with us. Dr. Shiraki, he's got your back. I love that song.
You should not have any problems getting into town. Once again, with the good doctor, here's Jai.
He's got Dr. Shiraki. Yeah, Dr. Shiraki, we welcome in chiropractor. Once again, answer a few questions, chiropractic questions we have. First off, let me ask you this. Do chiropractors need chiropractors?
Oh, yeah. I get adjusted regularly.
Do you?
Yeah.
Okay.
Yeah. Usually someone comes down to my office and we switch adjustments, or I'll go down to their place and we'll switch out adjustments.
Okay. You are famous for the honor box. You're the only one who does this, where you actually help me understand the concept behind the honor box.
Well, unfortunately in Hawaii, insurance benefits for chiropractic are not very good. And so a lot of times before the honor box, a patient would determine their frequency of visits based on finances. And a lot of times they would cut themselves short from what they really need. So basically what the honor box does, it allows a patient to pay a fee that's comfortable, affordable for them, and they pay it anonymously, so I don't know what they pay. And it just allows them to make sure there's no financial obstacle standing in the way of continuous, consistent chiropractic care.
Now, we're watching you give an adjustment right now. What would a typical sort of adjustment cost if you weren't covered? I mean, help me understand what a regular visit would be.
My standard fee is $40. In Hawaii, a regular adjustment could range anywhere from $30 to $70, I would say. Basically, my standard fee is $40. So if the person can afford the $40 or do like a payment plan type of things, they would do that. But if things are difficult and they can't afford the standard fee or a program option, then all the patients can pay what they can afford just to the honor box.
How often do you have to go, or does it depend on exactly what's hurting you?
It depends on when you come in, what the state of your spine is at. So most of the times we want to start off with a frequency about maybe 2 to 4 times a week, depending on how bad the problem is, what kind of symptoms the spinal problems are presenting. And as the spine starts to correct and the body gets stronger and more stable, you can start to see the chiropractor less and less until you get to a point of wellness or maintenance type of care where just a few adjustments a month maybe may do the trick.
So it depends, and each person is probably unique, aren't they?
Oh,
I mean, they
sure.
might not respond as quickly or might be a little slower to respond.
Yeah, I mean, I've had patients with severe back pain and one adjustment, they would jump off the table and feel like a new person, and other problems may take weeks or even months. So like you said, everybody is different. Everyone responds differently to chiropractic.
What do you tell people who, and you see it all the time, that actually do their own sort of adjusting their neck and that sort of thing?
Most of the time it's okay, but just to kind of demonstrate, when I look at a specific point of the spine, I try to identify how the spine is misaligned. Okay. And then when I do the adjustment, it's a specific movement back into the spine to get it to a corrected position. When a person's kind of arbitrarily cracking their neck, they don't know if they're putting it back into a better alignment or possibly even making it worse. So I've had people come into my office, they couldn't move. I said, "What'd you do?" He said, "Oh, I was trying to crack my neck." And most of the times it'll make you feel pretty good, but every once in a while you may crack it the wrong way and make
you could double cross yourself.
Exactly.
What's the youngest age you could be, or you know, can you be too young to go to a chiropractor?
Actually, I adjusted my kids about 15 minutes after they came out of mom.
Really?
And it wasn't an adjustment, it was more of a spinal check to make sure that, you know, everything was okay. The birthing process is one of the most traumatic experiences anybody will go through life. And so you just want to make sure that the spine is in check. But really, there's no age limit. I gave an 89-year-old woman her first adjustment last week.
Wow.
And of course, it's a little different than the adjustment you see on the video there.
I was going to say, it's different if you're dealing with a 32-year-old guy who lifts weights or something like that as compared to her.
Yeah, you have to modify your technique, the amount of force, the style with every patient. Every patient is unique.
All right. Well, Dr. Shiraki, how can I get in touch with you if they wanted to see you?
Well, if you want more information, you can go to the website over there, or call us at 841-2929. If you have any questions or you just want to get more information about chiropractic or my practice, just feel free to email me or give me a call.
All right.
Thank you, Jai.
Thank you, sir. Hawaii's Morning News will be back to wrap things up. Thanks for starting your, what are we on, Thursday with us. Almost forgot.